Is it biblical to separate conception from sex?
Gosh, that's an interesting question. Yes, I do believe so. I think so. So God definitely, so conception in terms of reproduction, God definitely said that one of the main purposes of being married and being together and being in a union of one man and one woman is to procreate and to fill the earth. Back to Genesis, right? But also, the Bible is talking so much about that relationship between a man and a woman and saying that one of the big gifts that God is giving man is to enjoy the life with the woman that he gave him. And I do believe that enjoyment would be physical, which would be spiritual, and it will be psychological in terms of companionship. So I do believe there's more than just procreation. In fact, I would say that it's a taking out of context of the Bible if you would say that sex is only for procreation. Mm-hmm. Furthermore, if you look at the Bible, I mean, if you look at the symbolism of the union between a man and a woman, the Bible, when it talks about that, it's not talking about in the context of procreation. It's talking about symbolizing the oneness between Christ and the church, symbolism, the oneness of the one flesh. And when the Bible is talking about these things, it's not talking about procreation. It's talking about that spiritual bond between husband and wife. So I would say, yes, it's totally biblical to separate. Well, in a way, you don't separate that, but they go together, but they don't always have to be connected to each other.
Right. Do you agree that doctors create life in IVF?
That's a question that we get a lot. And it's one of the main objectives in the church saying that that's true. But doing this long enough, I can very easily say absolutely not. All what we are is just like giving an antibiotic. What we are as fertility doctors is just that extension of God's hand, bring relief to the disease of infertility. So we need to see it as a tool, just as an instrument. What I've seen in practice is sometimes we have the most beautiful embryos, which is the body part of this new baby. God is still the one that put the spirit, empowers this embryo with the spirit. And the Bible is very clear. God is breathing the life in the spirit. And we've seen beautiful embryos never resulting in a baby. And with respect, I've seen some really ugly embryos, and God would still put His Spirit and His blessing in there. We have the most beautiful baby being born, sometimes from embryos that we really didn't think we had a chance. We just recently we tried to have 10 eggs, 10 embryos from a patient to give them a decent chance. We had a patient that only had one egg, and actually she was from Ukraine. Thinking about that. And the embryo should have been 4 cells on day 2. It only was 2 cells on day 2. We like embryos to have less than 10% breaking up, which we call fragments. So this embryo had about 70% fragments. Mm-hmm. And just in desperation, we transferred this embryo anyway. And God blessed, and we got a beautiful baby out of that. So doctors do not have the power, even if they want to create life. That power is still reserved for God and God alone.
Is it biblical to want kids so much to the extent that families go through financial distress, emotional distress? Or should they just give up? Is it okay to want baby?
That's an excellent question. I believe very strong in the power of no regret. And also, if you read God's Word, one of the things that it's talking about is this amazing 4 things that never gets enough. And one of those is the desire of a woman to have a baby, especially if they can't. And we're dealing with that and really seeing this deep, deep hurt in some women that cannot have a baby. And I think you have to be very cruel and in fact unbiblical to deny that for a woman that, that want a baby and cannot have that. So I don't think there's any price, if you can afford it, that's too high to pay for that opportunity. On the other hand, like anything else in a Christian's life, you're going to have to get direction from the Holy Spirit Himself. And there may be some couples where God say, no, don't do that. But as a general rule, my recommendation, unless God tells you no, and unless you really cannot afford to do that, there's tremendous value in doing everything you can. You can never guarantee that you're going to be successful, but there's a lot of value that we've seen in couples where they try and they're not successful and they can look back and say, I have no regret because I've tried. Mm-hmm. Where I've seen couples where looking back and say, we didn't want to spend the money. What if I just tried and have lifelong regret about it? So that whole concept of the power of no regret, I think, is very important. I do think that you have to have counsel directly from the Holy Spirit to see if that's right for you, and as a general rule, basic marriage counseling, right? There need to be a harmony between the husband and the wife. Divorce rates among infertile couples is one of the highest. Well, number one, people don't get married anymore, but in church we should still get married. But divorce, infertility is one of the highest stressors ever. And that is one of the main reasons for divorce in the church is infertility. And I do think a big part of that is because the husband and the wife are not on the same page, or they're blaming each other. And as a general rule, if there's not harmony between, just like with having kids naturally, if there's not harmony between the man and the woman, you need to tread carefully.
Thank you. Is it wrong for parents to select gender? And is it possible to select gender, color of eyes, color of hair? Is that a possibility today? And is it wrong? Is it sinful?
Right, so I'll try and keep that one simple. So let's just stay with gender for the purpose of this question. It's absolutely possible. We're doing this through a procedure called pre-implantation genetic screening, where we take some cells on day 5 from the placental cells of the embryo, sample that, freeze the embryo so we can freeze time until we can get the results back. Then we send those cells off and we can get the sex information back on that embryo. So there's 2 pieces in terms of if there's right or wrong. One is it right or wrong in principle to select the sex? Again, are we playing God by saying I want a boy or a girl? So that's the one piece. And the second piece is, and I think this is the more important question, what do we do with the embryos that is of the sex that we don't want? Are we going to discard these embryos? Are we not going to use them? Are we going to give them to another couple? So I would think that the second part of this is definitely wrong. We do have a moral and a spiritual obligation to every single embryo that we do create through IVF. So from that, so the second part I think is almost the easier one. I do think it's wrong to discard the embryos of the wrong sex. If somebody get 2 embryos, one is a boy and one is a girl, and they're totally committed to use both embryos, is it biblically wrong to decide to do the girl first or to do the boy first as long as I use both embryos? I think that's a softer question, and I don't have a strong opinion there, but my gut would say maybe that's okay to do, as long as we're not causing collateral damage to the other embryos or at the cost of the other embryos.
Thank you. Dr. Meintjes, the biggest question in IVF procedures for Christians, when does life begin? Is it on day 5 when you have embryo, or is it at some other time? And then the follow-up question, can life be frozen?
Very good question. So we don't know that answer for sure, but there are some things that make us wonder. I think to make it the easiest is we should, so there's a lot of science and a lot of discussion there, and we can hypothesize exactly when does life start. It may not be as simple as that it starts when the sperm enter into the egg, but for the sake of making this discussion maybe more simple, let's just assume we don't know exactly when life starts, but we know it starts early, somewhere among the first 7 days. And when we do IVF, I think as a Christian, we have the obligation to err towards caution. So I think, and I would propose, we treat every embryo as potential life. One of the things that Christians doing IVF 10 years ago had to struggle with was that the survival rate when you freeze the embryo was not 100%. It was like at 80%. So just by doing IVF, we would have lost embryos. And the great news is with new technology, our survival rate on freezing embryos today is pretty much 100%. With other words, we don't have losses anymore. So my suggestion would be, as a Christian, just because we don't know, treat every embryo as potential life. As a Christian, you should be committed to use every single embryo that you create through the in vitro fertilization process. And you can rest at ease as a Christian knowing that if you freeze an embryo, that embryo will probably survive. With the new technology where we can culture embryos for 5 days now, it really helped us out because we can now tell if there's a baby and a placenta. In the old days, we would freeze the embryo at the 8-cell stage, and that would only be a promise of an embryo. We wouldn't really know what's in there. These days, we can see that some of these embryos only is a placenta. There's no baby in there. And as a Christian, I have no problem discarding the placenta with no baby in there and only freeze the embryo that has a baby physically present that I can see under the microscope. And then knowing that there's pretty much 100% chance that it's going to survive, I think that makes the procedure much more palatable for a Christian. The problem or the challenge then would be on the Christian's couple side, before they start and embark on this endeavor to commit to each other, that whatever embryos are going to come out of this procedure, that we're actually going to use them. One of the big problems that we have in vitro fertilization clinics is the issue of abandoned embryos. We see every day how people abandon kids on the street. You've seen nothing yet if it comes to embryos, because in people's minds, it doesn't have the same value as a child. And it's really not uncommon for us, for people just to stop paying storage fees, never coming back for the embryos and abandoning the embryos. So what a Christian can do is make that commitment to each other and in front of God that whatever embryo is going to be created will be taken care of and will be used. So the church definition of life is when the sperm enter into the egg.
Right.
That creates certain problems based on what we see in the laboratory, and I do respect that Bible comes first, science comes second, but there's some black and white things that we see that's not disputable. One of the things, as I mentioned that earlier, only 1 out of 5 eggs goes on to make a baby. In fact, only 1 out of 5 eggs survive to day 5. 80% of all embryos self-destruct by day 3, meaning that they fall apart, they become powder. I do not think, and if we do genetic analysis on those embryos falling apart, it does not even resemble a human being. The chromosome numbers just doesn't add up. Then I've also mentioned the idea of about 5 to 10% of embryos is a placenta only with a baby. So sperm entering into the egg, meeting the definition of the church of conception. But then it grows to be a placenta and no baby in there. And typically women experience these as miscarriages. It's also called a blighted ovum. That's what the OBGYNs call it. I am 100% convinced that heaven is not going to be full of placentas running up and down. So very clearly, if the baby is absent, it's not a baby, even though, by definition, the sperm entered into the egg. So those are two of the problems that we're dealing with. Another problem that we're dealing with, or not a problem, but something that we observe, when embryos split, they make identical twins. Embryos split anything from 3 days to 14 days after fertilization. And when an embryo split, I'm going to have 2 babies with 2 spirits. And what happened when that embryo split? In fact, I can artificially, in animals, I can split the embryo with a razor blade under a microscope. When I do that, do I actually cut the spirit in 2 with a razor blade? Do I split the metaphysical with the physical? Or maybe, and I'm not saying, I'm very careful here, I'm not saying this is true, but is it possible that the spirit is entering after the embryo is splitting? Which at some point we have to go from 1 spirit if we leave it alone versus 2 spirits if we're splitting it. And then if you're just very simple, if you go to the dictionary definition of what's conception, it's not when the sperm enter into the egg. The dictionary definition of conception is when the embryo actually implant in the womb. Very interestingly, in the human, that's on day 7 when that actually happened. And the human is the only species where implantation, or the dictionary definition of implantation, is happening on day 7. In a cow, it's quite a bit later on, somewhere around day 14. In a horse, even later on, day 21 to 28. Mice earlier on, as early as day 4. Only the human 7 days, which reminds me on this wonderful number 7 that we find in Genesis 1, the 7 days of creation.
That's very interesting.
Yes.
At what point or what day do you insert the embryo into the mother?
On day 5 or on day 6. So, which is the blastocyst stage, and that usually after we've frozen it and thawed it with modern technology. When we try to take the embryo to day 7, in general, we're much less successful, and it's a much higher chance for that embryo not to survive.
Thank you. What is infertility?
Yeah, so that's a tough question. Infertility basically is the inability to have offspring, to have babies. What is the scientific definition of infertility depends a little bit on the age of the woman. And to appreciate the whole discussion of human infertility, we have to distinguish between the man and the woman, and they work a little bit different. It's not uncommon for men to still have babies in the later ages of life, like 70, 80, in theory, even up to 90. Because men are made different. Their stem cells keep on replenishing and they're making new sperm on a continuous basis. On the lady side, it's very uncommon for a lady to naturally have a baby after the age of 40. Not impossible, but it's getting less and less likely because women are born with their eggs and their stem cells go into a resting phase and they don't make new stem cells. So whatever number of eggs the woman is being born with is going to be finite and it's going to get used up over time. And typically around the age of 40, most of those eggs are used up.
So every woman is born with a certain amount of eggs.
Something like 300,000.
And by the age of 39 or 40, all those are been used up.
And you also have to appreciate, as a woman go through these monthly cycles, they're not using one egg at a time. They're really using anything from 10 to 100 eggs at a time. Because up to 100 eggs are being recruited as the possible one to ovulate that month, and only one of them actually make it to the end point. So we're using quite a few eggs on a monthly basis as women go through her fertility cycles. So women and men are quite different from a fertility perspective. So as a general rule then, the fertility potential of a couple is usually determined by the wife. So if we ask or counsel somebody, I almost never ask the guy how old he is. We don't care. He's going to have enough sperm. We always ask how old is the woman. So as we make a prognostic, trying to find out how long it's going to, what's the chance for somebody to get pregnant, it all depends on the age of the woman. So definition of infertility, depending on the age. That's where that came from. And as a general rule, the scientific definition of infertility is if you had unprotected intercourse for X amount of time. If you're younger, usually up to a year, and you don't get pregnant, then we consider you to have a fertility challenge. And if you're older, as little as 6 months, if you can't get pregnant within 6 months without unprotected intercourse, then we would consider you having a potential fertility problem.
I think you shared yesterday that 2% of all babies born today, born through IVF.
Correct.
What are the main reasons for infertility?
Right. So, and I think it's important let's just distinguish between infertility and IVF. So IVF is in vitro fertilization. So infertility is the inability to have a baby, and then we can treat it with different treatment options, hormone corrections, inseminations, boosting sperm counts, all different types of things. And those, I would call those the Toyotas of infertility treatment. And then we get the Mercedes of infertility treatment, which is the more invasive, more aggressive treatment, which ultimately the last level of treatment, the more aggressive level of treatment then will be in vitro fertilization. So infertility treatment as a spectrum, in vitro fertilization is typically the end point, the most invasive to do that.
So how should a Christian family, say they get married, they've been living together for a couple of years,
after they got married.
Right.
Yes, okay, good.
And after a couple of years, they think that's something wrong. They go to a doctor. Doctor says that your only option is IVF. How should Christian family look at IVF?
So one of the objections we hear in church a lot is don't mess with fertility issues because you're playing God. And my response always is we need to understand where all of this is really coming from. You really need to go back right to the beginning of the Bible in Genesis, and it's teaching us that death and suffering is a result of the original sin, the sin of Adam and Eve. And because of that original sin, then there was a curse on creation, and everything started going downhill from there, and that's what we're seeing today.
What should family do when they're thinking about IVF? What should they try before they actually deciding to do IVF that they perhaps have not tried before? As a doctor, what would you recommend them?
I think the most important is get with a fertility specialist and, go with that definition of what is infertility. A lot of people waste a lot of time trying their own things, and then reproductively, the woman is getting older. And remember, that is our time-limiting factor. That's really a time bomb. on the female side as she's getting older. So if that definition of infertility for an older woman, reproductively older, 38, 39, 40 years old, is 6 months of unprotected intercourse, after that 6 months, stop trying to do anything, get some help so that you can get pregnant quickly.
How long does IVF take? And the next question, how does it practically work? So if a couple comes in to you and says, we want to go through the process, can you run through the process step by step? How does it work?
Yes, I'll do my best. So you get diagnosed with some reason for infertility. Sometimes we don't even want to know why we're infertile. We just want to get a baby. Between the doctor and the patient, they decide we're going to do IVF. It's the first part of how it starts. First, make the diagnosis and decide this is the treatment. Then we need to make more than one egg. The reason is that only 1 out of 5 eggs is going to have baby-making potential. So for every 5 eggs that we get from the woman, and remember, the woman is the pace setting, is a rate-limiting factor here because of her age. Only 1 of 5 eggs is going to be viable. So in general, we like to have a backup. So in general, we're trying to get 10 eggs. That's a problem because a woman only make 1 egg per month. So now we need to use fertility drugs to help her to make 10 eggs. That process of stimulating the ovaries to make 10 eggs takes about 10 to 14 days to take those fertility drugs. After those 14 days, the eggs are getting harvested with ultrasound. It's a very low invasive ultrasound guided biopsy procedure, getting the eggs out. That takes anesthesia. That is a semi-surgical procedure, typically happening in a surgical suite. It takes anything from 10 to 30 minutes to get the eggs out. The eggs go directly from there in the in vitro fertilization laboratory. About 6 hours later, so once we start working with the embryos, we're really on the clock on a per hour basis. About 6 hours later, it's when the sperm and the egg go together. 2 ways we can put the sperm and the egg together. We can either put 30,000 sperm with the egg and let the best guy win, or sometimes we don't have 30,000 sperm, and then we use a ICSI procedure, intracytoplasmic sperm injection, ICSI. And we actually inject the sperm physically into the egg. 17 hours after the 6 hours, we check for fertilization. We can actually see if we've got a male set of genes and a female set of genes. About 5 hours later, they actually coalesce together, fuse together, and we now got a 1-cell embryo. 2 days, 4-cell embryo. 3 days, 8-cell embryo. 4 days, about 80 to 90 cells. And then 5 days, this is when we call it a blastocyst, we now have about 180-cell embryo. Benefit is we can see if there's a baby in there, and we can see if there's placental cells. We can see that differentiation. In the old days, I'm talking 2 years ago, 3 years ago, we would transfer the embryos at the blastocyst stage back to the mother. The new days, which is now, we actually found out that we can improve the pregnancy rates by taking that embryo and first cryopreserve it, because mom has a super stimulated womb. It's not a natural condition womb. Then we allow mom 1 month to recover, for the womb to just go into quiescence again and slow down, and then get the womb ready and receptive again, then thaw that embryo and transfer it. So the actual IVF process on the front end takes the 10 to 14 days of stimulation, the 5 days of embryo growth, and then freeze, and then we stop. And then you wait a month, and then you come back for the embryo transfer. So overall, about 2 months.
2 months, okay. How is IVF different from cloning?
IVF is when you put the sperm with the egg, and you get a fertilized embryo in vitro, meaning in glass, was the old word, outside of the body, fertilization. Cloning is when you take the embryo, after you got the embryo, you make many of the same ones to mimic each other. So it's what the word cloning means, right? You're trying to duplicate, copy-paste of the same embryo.
Gotcha. So is cloning not biblical? Or
That's a tough question. There's 2 parts of that. One is with cloning, I'm duplicating a body. I can never duplicate the spirit. Only God put the spirit in. So 2 clones, which the perfect example of clones, by the way, is identical twins. Identical twins is a clone. We do know that identical twins have 2 different spirits because God is the only one that put the spirit. We're not putting the spirit if we're cloning. So strictly speaking, I would say just doing cloning, meaning that we're making a copy-paste of the body, God still put the spirit. I don't see anything in the Bible that's against it. The problem with that is, in the process of cloning, my success rate is something like 2 or 3%. and I'm killing all the rest. So I got all these collateral losses. And I think from a biblical point of view, you got a problem there.
Thank you. Are there any side effects to mother or a child when she or he is born when they go through IVF?
One of the biggest risk factors with in vitro fertilization is the side effects of the stimulation. Because you're putting somebody through what they call supraphysiological levels of hormones. Sometimes they can develop side effects of hyperstimulation, which it's getting less and less. People are getting much, much better at that. But it can cause people feeling sick, not feeling good, up to and including death. There are rare cases of people actually dying from that, from the hyperstimulation. There are all types of studies saying that being exposed to these higher levels of hormones may have later in life an increase in reproductive tumors or cancers. There are some indications that there are small increases in that later on, but you need to look at your risk-benefit ratio and see, do you want to have a baby at all or not?
I've heard that kids, when they grow up, there are side effects. They're different from just regular kids. Have you ever seen that?
There are quite a few studies looking at that, and it's a little bit difficult to look at that because your IVF kids are a special group of kids by definition, meaning that they're typically born from older women. Sometimes because of the underlying infertility issues like womb issues and so on, they're also more likely to be born prematurely. So being born from an older woman, being born from somebody that has the disease of infertility, and being born prematurely, each one of those things are factors that is going to cause more morbidity or more issues with kids. So it's maybe not fair to say it's because of IVF. It may be because, maybe as simple as just because they're born from older women in general, which is more common.
Are there sinful things that could happen or families should watch for in the IVF procedure?
Yeah, I do think so. So I'm trying to think of IVF as a tool, like a hammer. And you can use a hammer, what it was designed for, to do construction, or you can use it to kill somebody. Doesn't make the hammer bad. It's just that's the tool that we have. So let's look at IVF as a tool. So we need to make sure we use the tool right. How do we use it right? We use that within the confines of marriage. We use that as long as we can answer the question, we're treating the disease called infertility. We use that as long as we're not destroying life, which is going to come to a further discussion. When does life start? As long as we're not destroying or causing collateral damage in the process. And then the other fascinating thing, and I know this is a little bit sensitive, that a lot of men struggling with the IVF procedure. When we do IVF, we need an egg and a sperm. The egg we get with surgery. How do we get the sperm? We need to get the sperm through a collection procedure where the husband has to produce that sperm sample. That I've seen more often than not being a big troubling spot for these guys that on demand without the presence of their wife having to produce a sperm sample.
Right. What if her health declined after first pregnancy and she physically can't get pregnant again?
So there's two very viable options for a Christian couple. One would be is to use a surrogate, a sister, sometimes even a mother, to carry that baby and still give that baby a chance to life. And then another very viable option, which is not for everybody, but there are a lot of couples that cannot afford an in vitro fertilization procedure, and there's a tremendous need to adopt embryos. That is a very difficult thing for couples, and it's not for every couple. Some people just cannot stand the idea of giving their genetic material, their embryos, up for adoption. But I've also seen couples where that really gives them peace of mind, where it's absolutely impossible for them to have another baby for whatever reason, financial or physical, and then getting closure by giving those embryos up for adoption. And you can specify what type of couple you want to adopt the embryo. And one of the more beautiful stories that I've been involved with is actually when people know the people that's going to adopt their embryo, which makes it a little bit more challenging. We had a case a few years ago of two couples standing in a row at Walmart, checking out and just making small talk. And this came up. Long story short, the one couple donated the embryos to another couple that they met in Walmart. And they're actually raising all these kids together now, basically knowing each other. But so
Interesting.
adoption is a viable option.
Thank you. Thank you. Is it moral for Christians to use the service of surrogate mother?
So it takes 3 things to make a baby. I know this is basics. It takes a sperm, it takes an egg and a uterus. And the bigger question is if we miss one of these 3 and we treat the disease of infertility, is it okay to replace one of these with help from outside? And the example that you're using is we got sperm, we got eggs, we don't have a uterus, we don't have a womb. If that uterus is being offered from an altruistic point of view from somebody like a sister or a very dear friend, or even sometimes a younger mother, we have seen where that can be a beautiful story. But we've also seen where that can be a disaster if the relationships between those people are not sound and if the expectations are not spelled out. So I would say, just at face value, it's not necessarily unbiblical to use a surrogate to help treat the disease of infertility. But I do believe that has to be done on an individual basis and make sure that the relationships is sorted out, and also make sure that for individual people, there's not a conviction by the Holy Spirit that that's something that they should not do.
What should they talk about? That mother and the potential mother.
Like if it's mother-in-law that's going to carry the baby, is what are we going to tell the baby? What is your involvement going to be in that baby's life? Is this going to give you a right in that baby to tell that baby what's right or wrong, or are you going to respect our parental rights? What is the extent of your involvement? Is it carrying the baby and then shut up and no more? Or is this now giving you a right into our baby's life where you're going to help us raise the baby? So those expectations, and different people and different cultures have different tolerances for these things. But I do think that these things need to be totally spelled out. And in fact, we usually suggest that there's actually a contract for that. There's also certain legal liabilities. In a lot of states, the mom is not the owner of the egg and the sperm. The mom is the person giving birth. So when a surrogate gives birth to the baby, that baby legally belongs to the surrogate, and in theory, they can take the baby and run. So you do want to make sure that everything is taken care of.
Thank you.
So there's this question that if we're using what we call third-party reproduction, that we're violating the marriage covenant between a husband and a wife. I do believe that the strict biblical definition of that has to do with sex, has to do with that intimate relationship, that becoming one flesh between a man and a woman, that's violating that. When we do things like in vitro fertilization, where that is being done in a laboratory, or in this example, we're using a surrogate uterus, I can make an argument that this has nothing to do with that physical relationship between a husband and a wife. And all that we're doing is we're providing assistance and we're providing a tool to make this pregnancy happen. I do think the attitude or the spirit with which this help is being provided matters. With other words, is it altruistic? Is somebody really doing this from an unselfish point of view? Or are they doing this with other reasons in mind to get control over a couple or so on? But in general, I would make a case that this is not violating that marriage covenant in the instance of a surrogate. Now, if we talk about donor sperm, donor egg, it's a different perspective and it can get more complicated.
Thank you. Is being a sperm donor a sin?
That's
For male.
I think you have to get counsel from God directly on that one. Things to do consider is why are you donating your sperm? You're donating your sperm for money, or you're donating your sperm because you want to do the world some good, which brings in some pride issues maybe. In general, my experience is people do this only for one reason. They do that for money. You have to give some thought to what's going to happen to your sperm, where it's going to be used. By donating your sperm, it's hard for me to see a way how your sperm is going to be used in a biblically sound way. One of the most common reasons donor sperm is being used for today is for non-traditional relationships like same-sex couples or single women that does not want to have a man in their life. I do believe that if you get involved in those lifestyles by enabling that and more importantly, helping and assisting to bring a baby into a world which we as Christians do not believe in, I would think that's maybe something we don't want to do.
Thank you. Next question is it okay for a single woman who knows that she won't get married to do IVF? And then follow-up question, how about adoption? Same woman, she knows she won't get married, but she wants to serve that child. Is that biblical, and is it biblical to do IVF?
Yes.
How do you distinguish both?
Right, and I think there's the single women wanting to do IVF. What is more common now is a single woman freezing her eggs for future use. That's really preserving her genetic material. I really don't have a problem with that. I think that's a reasonable thing to do, just to freeze your eggs. So you haven't found a Christian man to marry. You really know you want to have kids. You're sitting on this time bomb. Your eggs are getting older, not you. Is it okay to freeze those eggs so that if I marry my Christian husband later on, that I still have young eggs of my own? I think that's new technology that's available. I think that's smart, and I think that's definitely not contrary to what the Bible teaches.
And she could carry that.
And she can carry her own baby. So she can stop making eggs at age 38 because of natural infertility. She froze her eggs when she was 24. She now found Mr. Right. She married the Christian man from church. They decide to have babies. Remember, his sperm doesn't get old. He has sperm. She's 38, infertile, but she got 24-year-old eggs of her own, still fertile. Take his sperm, put it with her eggs, put it back in her, and they have a baby that otherwise would not have been possible. So that's one spectrum. I think that's great. I think it should be done, can be done under the right circumstances. However, it costs money. When doing IVF, by IVF, you're inferring that we actually fertilize the egg first with the sperm.
Right.
Now she's going to have to use donor sperm. I don't think that's the right thing to do. That's really procreation outside of marriage. We should not do that. That's straightforward. The other principal thing to think about here is the question to always, when you look at adoption, when you look at embryo adoption, when you look at egg freezing, you should always ask the question, do I take a bad situation and making it better? Because the ideal situation is a man and a woman and a child, a dad and a mom and a child. That's God's design. That's what we should strive. It's not always possible. So if the husband divorces his wife, run off, cheat on her, and she's suddenly a single mom, it's not the ideal situation, but she's doing the best she can. So she's taking a bad situation, doing the best we can. If there's a child on the street and doesn't have food, and there's no couple that's willing to adopt that child, and there's only a woman, then I think it's fine, because we're taking a very bad situation and make it one little bit better. If there's a child on the street and there's a couple that want to adopt that child versus a single woman, the better place for that baby is with a couple. So when we create embryos for adoption, I think that's different. So we don't have a bad situation. And we do see that in practice, where a woman comes in and say, I don't ever want to get married. I'm a lawyer. I have enough money. I don't need a man in my life. However, I want to have a baby. Please make me a baby. I'm not infertile. I'm infertile by choice, which is different by being infertile because of disease. I'm infertile by choice. I'll give you $300 for sperm, fertilize my eggs, and get me a baby. I have the financial means to raise this kid. We see that all the time. Personally, I believe that's outside of God's plan. We should not do that.
Thank you.